Thank you, Mr. Speaker. I beg to move that leave be given to bring in a bill to require the Secretary of State to instruct general practices to issue annually to each person eligible for care provided by the National Health Service an itemised account of the cost of his or her health care in the preceding 12 months and for connected purposes. It would appear that by chance I am going to be the warm-up act for the opposition debate on the NHS risk register. This is purely coincidence, but I think it is timely, and I think it is fortunate for me that it is the case, because what I'm going to propose, I think, is a serious policy suggestion which should be considered by all sides of the House. For decades, so-called informed political opinion has argued that significantly changing healthcare provision in Britain is not possible. Don't touch the NHS, they've said, it will be political suicide. My political contemporaries and I do not have the luxury of this option. Healthcare costs, driven upwards by an inexorable increase in patient demand, have now reached a tipping point. Any politicians who think that the current NHS model can be sustained in the medium to longer term under this onslaught are deluding themselves. Indeed, to think so belies a remarkable ignorance of the realities of healthcare demand in Britain today. For sure, changing the public's mindset on the issue will be an extremely painful political process with no short-term reward, but we have no choice, particularly those of us who want to protect the fundamental principle of access for all. No doubt advocates of change like me will face professional and personal vilification. Just observe the recent treatment of present healthcare reforms by the vested interests. And they are just about modifying the system of supply. However, I'm not interested in a party political spat. First and foremost, I care about my country and its people. I am determined to communicate that there are other ways to provide and pay for healthcare, that there is life after the current NHS, and that it could be better. For I want people to be free to choose any lifestyle, whilst understanding that the consequent healthcare costs are their responsibility. I want to give more to the truly deserving because we have spent less on those who were perfectly able to provide for themselves. Because where is the implicit incentive to look after oneself in the current system? It is not there. In its place is a clever ruse to breed dependence on the state, an ingenious construct for supporting a command and control, tax and spend bureaucracy headed by a wealthy elite who, ironically, often opt for private healthcare themselves. Where is the long queue of nations lining up to replicate the National Health Service? If imitation is the sincerest form of flattery, then the NHS is flattered not at all. For example, in Denmark, patients, with very few exceptions, pay for their drugs at cost. In Norway, patients pay to see their GP. These rich countries and others could see that the present NHS system was unsustainable in the longer term and implicitly based upon rationing. Remember, the NHS is predicated on the Bentham principle of the greatest good for the greatest number. So don't hold your breath if you need expensive new cancer drugs in the future. The system will not be willing or indeed able to pay for them. Clearly, securing public support for fundamental change is always imperative. To do so, I believe that the true costs of healthcare must be known by all. That is why I am presenting this bill to Parliament, calling for the introduction of an annual personalised statement of healthcare costs to be issued to everyone. Irrespective of age, the costs of GP and hospital appointments, drugs, surgery, vaccinations, diagnostics and treatment would be itemised. By doing this, I believe that the British public would be more receptive to NHS changes in the future. The knowledge would be empowering. Now, I'd like to move on to addressing the obvious questions and concerns which colleagues might have, particularly those who fear additional government paperwork. Bureaucracy. Well, it would not be bureaucratic for the patient. A simple itemised statement with attached NHS number based on healthcare provided. Most of the data does exist. Indeed, it all should exist, and is generally in a form that can be easily extracted. Furthermore, GPs I've spoken to would relish the opportunity to clarify the true costs of hospital interventions. So forcing that knowledge to the surface would attract widespread support in the primary care sector, particularly in the new age of commissioning. Believe me, GP support always matters when introducing something new to the NHS. Now, cost. Well, postage. I mean, GP practices issue correspondence to patients every day. Letters to remind them of flu jabs, cholesterol checks, medication reviews, and chronic disease annual reviews, to name but a few. Hence, numerous interactions with patients take place already, so why not add a printed statement in the envelope? After initial modest startup expenditure, the running costs should be minimal. On the basis of a simple internet search of data extraction software management charges, a pro rata administrative salary of £25,000 per surgery.
For interrupting the honourable gentleman, quite a lot of noisy conversations in the chamber, which is unfair on the honourable member. He must be allowed to introduce his measure and get a hearing. Dr. Lee.
Thank you, Mr. Speaker. I might note that some of the heckling opposite, I must say that this idea is to be shared with parties, and indeed I think if there is a future Labour government, God forbid, they may benefit from the public understanding the true cost of healthcare, particularly in view of the fact that members on that side have in the past suggested co-payments as a solution to the present NHS difficulties. Anyway, I was saying, after initial modest start-up expenditure, the running costs should be minimal. A pro rata administrative salary of £25,000 per surgery, data extraction software management charges, additional printing costs, etc. My office is estimated at approximately 50 pence per patient per year. A total annual expenditure for England and Wales of around 30 million, 0.03% of annual NHS spend. Indeed, that figure could be lower, as it would be part of the details of my bill to make it in the financial interest of each GP practice to keep overheads to a minimum. And indeed, if it was more, I would suggest that the impact of these statements would lead to fewer people failing to attend outpatient appointments and fewer people storing drugs in their larders at home, thereby saving the NHS money. And the final thing I'd like to address, the final concern that's been expressed to me, is upsetting patients. It has been suggested that those who receive most of the care, the frail and the elderly, might not appreciate receiving a statement, that it might be distressing and lead to avoidance of healthcare. Well, all I can say to that concern is that we can't all be young all of the time, so when would be the right time to introduce this policy? Those who are young now need to know how much they are going to cost when they are old. Why should the elderly benefit from a system that is unlikely to be there for the young when they need it? To be blunt, it is time to tell it as it is, not as we would wish it to be. Tough politics? Yes. Morally and politically right? Yes. To both. In conclusion, by presenting this bill, I'm not advocating any particular policy solution. Indeed, I encourage both sides of the House to come forward with different policies in response. I am merely suggesting that having introduced these statements, an informed public debate about future healthcare provision would begin, a debate that is long overdue in this country. The challenge facing the NHS is not one of supply. The demands being placed on it because of ageing, obesity, and changes in health-seeking behaviour mean that governments of all political colours urgently need to bring forward plans that are truly sustainable in the longer term. For that reason, and for all the others that I have given, I respectfully submit that this bill is timely, and I commend it to the House accordingly.
The motion is that the honourable member have leave to bring in the bill. Mrs. Anne.